good situation, it's not bad, it could be better. The basis of the system are the Spanish Constitution, Article 43, that states that the public authorities have to implement a system to promote and protect the health of the public, of the people, of the citizens of Spain. The General Health System Act of 1986 that states a complex system based on we call el Estado de las Autonomías. That means that we have a kind of federal, it's not a federal state, compound of 17 different regions that have competences, legislative competences, and development competences, and different matters, and one of those matters is health. And in 2002, the process of health competence transference to those authorities, to those regional authorities, are finished, and we now have a general umbrella that is provided by the General System Health System Act, and 17 different subsystems of health care in general. So, in those systems we have the same structure. We have a structure with primary attention and specialized attention. Primary attention implies the level, the territorial level, more closer to the patients, closer to the people, and it has two different organizations. One for territorial areas that have in which live less than 25,000 people, and then bigger areas that function like umbrellas for those little ones that are for population around 200,000 to 150,000 people. In the primary attention is where domiciliary attention is provided in a natural way in Spain. So there are some programs, specifically two programs that are provided by the General Act of 1986 that are provided in the whole territory of Spain, independently of the region. That are a program that is called of the program of the patient paralyzed. He is a patient that cannot go to the health services by his her foot, and the other is for terminal attention, for people that is terminally ill, but not palliative attention. Palliative attention are provided by specialized attention. So this is the first level, and the second is the specialized attention that has also domiciliary attention, but in a lesser or a minor level with regard to the domiciliary attention provided by primary attention. And the second part in specialized attention is domiciliary hospitalization, that is provided by specific units of the reference hospitals. And right now in Spain there are only around 100 units of domiciliary hospitalization, because they are expensive, they require a great equipment, and they require of very well trained professionals. They are provided by multidisciplinary teams, so there are doctors, nurses, physiotherapists, psychologists, etc. And in both levels, the attention is not only for the patient. In many cases, it is also for the carers, for the informal or non-formal carers, because we are concerned, at least here in Spain, there concern that is growing about the health and the conditions of the informal carers of the patients. And we talk about the social sanitary approach that is provided by the Act of Dependency, Attention and Autonomy Promotion, that it was approved in 2006. This law that tries to give a response to a big problem in the space that is elder people. We have right now around 18% of the population in Spain is older than 65 years old. And if trends confirm what the organizations, the international organizations related to demography are expecting for us, in 2015 we are having around 30% of the population older than 65 years old. It's too much. Right now we have like 5% of the old people is older than 80 years old. So we are experimenting what is called an aging of the aging. So the people, the old people is older than ever. So we have a problem, and this tries to provide what is called a socio-sanitary approach. There is a white book provided by the Ministry of Health and Sanitary Affairs, and they want to set some guidelines. They did the book last year, 2011, and they want to provide some guidelines to coordinate the sanitary and the social attentions for dependent people and old people. It's related, the dependency and aging. And the initiatives more important now are hospitalization, that is growing. But we have 100 units all around the territory. And of those units, only 2 or 3 are private units. Almost of the system is a public system. There we have the figure of the limping nurse or case manager nurse, also called, that has been implemented like 10 years ago in Andalusia. And it's working very well, because what this kind of nurse does is to coordinate all the health services that a person can need in a special or specific moment. The care to cares, it's also very, very important. And the social sanitary approach that comes from the law and that is trying to be developed right now. Okay, that's all. Thanks for your attention. And if you want or have any questions, please stand up.